5 signs and symptoms of high cholesterol you should know. If levels of low-density lipoproteins cholesterol are too high, or levels of high-density lipoproteins cholesterol are too low, fatty deposits build up in your blood vessels. These deposits will make it difficult for enough blood to flow through your arteries. This could cause problems throughout your body, particularly in your heart and brain, or it could be fatal. People often ignore the warning signs of cholesterol until the problem becomes severe. It is important to be aware of these signs, as addressing the problem early can save you from future complications. If you have multiple signs and symptoms of this problem, ask your doctor to check your health levels. The best cholesterol treatment. Here are the common signs of cholesterol that you should know. 1. Frequent tingling. Tingling in the hands and feet is a sign of low blood circulation. This occurs when the blood flow becomes slower because of the high levels of cholesterol in the blood. Poor blood circulation causes nerves in your hands and feet not to get enough nutrients and oxygen, which gives you the tingling sensation. Tingling in the hands and feet are the implications of disfluencies blood flow in certain parts of the body. Tingling associated with nerves do not get the blood flow. This is because the blood flow becomes thick due to high levels of cholesterol in the blood. Leg cramps, numbness or spasms that hit you during the night, usually in the heel, toes or forefoot, may also indicate high cholesterol. If you hang your foot off the bed or sit up in a chair, it should start to feel better as gravity forces blood flow back into your feet. 2. Frequent headaches. Frequent headaches in the back of the head might be a result of clogged blood vessels in the area around the head. This occurs due to clogging of cholesterol plaques start forming in blood vessels. If this condition is left unchecked, the blood vessels can rupture and lead to a stroke. Headaches are most common in people with hypertension. This is a very dangerous condition because the possibility of blood pressure is very high. Blood flow that is too tight through the arteries can cause blockage of plaque leak or rupture. If it occurs in the brain, then it can cause damage to blood vessels. Headaches can also be a sign of a stroke that becomes the initial indication of a newly emerging attack. 3. Your hands and feet are always cold. Before we continue this video, do not forget to subscribe my channel to see other useful health videos. If your extremities are getting cold for no reason, it could relate to poor blood flow. If you notice one foot or hand is cold and the other is not, it's especially important to bring it up to a doctor. Feet or legs that feel cold, or are cool to the touch, may be an indicator that you have peripheral arterial disease. But it's not really the best indicator. That's because this is a common problem, and it can happen to anyone as he ages, even someone without peripheral arterial disease. However, if you feel like one leg or foot is cold, but not the other, it could be time to talk to your doctor. 4. Left chest pain. Left chest pain is another sign of high cholesterol levels. Even a minimal plaque creation in any part of the body can decrease blood flow. The heart works more to restore normal blood flow, and this can cause pain or palpitation. This pain can also be a sign of a heart attack. Left chest related to the heart that acts as a blood pumping. Blockage of blood vessels around the heart can cause pain like impaled. The pain may even spread up to the neck. Chest pain can also be a sign of a heart attack. This condition can be a sign that blood cholesterol levels are too high. 5. High cholesterol symptoms in men. Erectile dysfunction in men caused by high cholesterol is one of the manifestations of blood vessel damage caused by high cholesterol. Your cholesterol levels can affect the quality of your erections. Most cases of erectile dysfunction, ED, are caused by impaired blood flow to the penis. The medications that treat ED, like Viagra, allow the smooth muscle cells lining the blood vessels to relax, so that blood can flow more easily. When a man has high cholesterol levels, not only is cardiac circulation impaired, blood flow throughout the body is impaired, and this can affect erection quality. In fact, many doctors consider ED to be a sort of canary in the coal mine signal in men under 40, and may suggest cardiac tests to determine if a young man with ED is at risk for, or in the early stages of cardiovascular disease. Cardiovascular disease is more treatable the earlier it's caught.
Mm-hmm.